Is the College of Health Sciences in affiliation with a medical center, CMC Northeast? Is that the usual model for how folks come through the academics of nursing to become specialized in their field, or is it normally done in a college, university environment, or is the Cabarrus College of Health Sciences, is it unique, or is it a typical model?
It is somewhat unique. There are not that many. I think there are like maybe 65 programs similar to ours across the country. So there is somewhat of a uniqueness about that.
Just a little bit more than one per state on average.
Exactly. But that's not to say, good math, Alex. But anyways, a lot of nurses come through the university systems. I mean, UNC Charlotte has a good program. You've got the programs at Duke, you've got them at Chapel Hill. But those nurses are entering into and are obtaining a baccalaureate degree first. Our program is set up such that you can be in what we call obtain an associate degree, which is a nurse that has been trained in a 2-year time period, versus going into a 4-year program. One of the things, though, that we have at the college is you may come in, you may get your associate degree, and our philosophy is we want to be able to give you a point, get you into the workforce as quickly as we can. But we also have what we call a completion program. So if you've gone out, you're an associate degree nurse, you've written your certification exams, possibly in a work situation, then we offer a 2-year program, which we call our baccalaureate completion program, that allows you to come in and get a baccalaureate degree, same as those that may have gone to a university setting initially.
That was an excellent answer. I thought Alex was asking about your strategic location next to a mall, a Chick-fil-A, and a Starbucks. So she gave a great answer. Tell us how many people you employ.
We have about 60 faculty, okay, and that's on a full-time, part-time basis. We also have about another 30 what we call adjunct faculty. Those are folks that may be coming in and teaching a class here or a class there for us. And then we have probably about another 20 staff people, support people, professional staff like Mark, who play a very important role in the organization in terms of, servicing the students or doing what we can to, strengthen the students' experience with us.
In your physical plan, you've got your primary facility is a brand new, beautiful 4-story basement building.
We call it our lower level.
Beside the mall.
Beside the mall.
But is that the extent of your physical plan?
That's where we do our primary, our didactic education. I mean, if you talk about, we have clinical affiliations, so actually, while we have students that are outside the walls of the college that are actually practicing in the nursing profession or what have you. So I would say that while we physically are in this 65,000 square foot building, we also extend beyond those walls. Our continuing education program, though, doesn't necessarily need to take place there. We actually have programs that we offer at the hospital, or it could be any place, quite honestly. It could be the police department, a fire department, just depends upon what the need is.
All right, well, when we come back from break, we're going to talk about other folks that work with you. We'll get into Mark's role, and in the meantime, Alex will be looking up didactic pedagogy. So put the clicker down, we'll be right back.
And we're back.
Welcome back to Business Focus. Alex, take it from here.
Diane, there's this tremendous nursing need, healthcare need throughout the country that John was talking about earlier. Are people beating down the doors to get training in nursing and medical services, or do you have to go look for them, or how do students find Cabarrus College of Health Sciences?
Do you have a recruiting process? I think that's what the man is trying to ask.
Well, I'd like to say I hope we have students beating down our door, but I'm going to let Mark Ellison, who's our Director of Admissions, answer that question.
Very good. We do. Cabarrus College, this decade has doubled in size. Our enrollment was right around 200 at the beginning of the decade, and now it's up to 430, as Diane said. Our application for admission have tripled since 2003, so there's a lot of interest in not only nursing but the other healthcare degrees that we offer. We do a lot of outreach to high schools, middle schools. We'll go into the classrooms and talk with students in science classes or allied health classes and talk about not just Cabarrus College, but what's available in healthcare, just to give them an idea of what all's out there, and then invite them to come to Cabarrus College to one of our open house programs, just to really learn what the college experience is all about. That you really don't know till you visit a college campus if it's the right fit for you. So we encourage folks to look at our college and look at other colleges and find the place where they can be most successful. A lot of students do come to us because they find that the small classroom environment where the faculty member knows your name and they can talk with you after class on a first name basis.
What is the ratio, Mark?
Average class size is about 20 students.
Okay.
So the vast majority of our classes are 20 and under. And then when you're outside of the class, all of our faculty offices are there on the 3rd floor. So you can walk by the faculty office, sit down and have a conversation with the person teaching your class, and that person also can serve as a mentor. We've got faculty like Kristen Barbie, who has worked with several of our students, but particularly 2 that have become North Carolina Nursing Students of the Year since 2006. And then she was recognized as an Advisor of the Year in the state. So there's a lot of one-on-one interaction that makes a difference in student success. When students come to college, they're making an investment in their future. So they want a return on that. And that return is when they graduate from Cabarrus College, they're going to do well on the national certification exams. Our occupational therapy assistant students had a 100% pass rate this year. Our nursing students have had between 91% and 95% pass rate since 2003. So if you come here, you're going to get a quality education that's going to help you be successful down the road. So that's why students seek us out.
Who do you compete with for students?
Well, we compete with the university system. We have students that are looking at our associate degree nursing program, but they're also considering bachelor's programs. So, and what we tell students is, they both offer strong options, but you've got to find the place that's best for you. Students who come into the associate degree nursing program, what they like is that first semester, you're getting into that clinical experience right away. So they really like that hands-on experience, being able to get over to the hospital and start that nursing education immediately. So that's what students who come to us really like. They like the hands-on part and being able to really experience what being a nurse is all about.
And they're performing those functions in a hospital on patients, temperatures, blood pressures, phlebotomies, those kind of things?
Yeah, they've got that clinical setting. They're over at Northeast and at other locations in the region, really getting that hands-on experience.
That was a lobotomy that you had done, John. How broad a geographic area are you drawing students from?
Well, our primary service area is Cabarrus and the areas around us. So Cabarrus, Iredell, Mecklenburg, Rowan, Stanley, and Union that's our primary service area, and that's what we've identified as.
So that kind of goes with the model of that Diane was talking about earlier, of somebody that comes in for an associate's degree and goes into the workforce and then continues working on their bachelor's over time.
We've got students who come in, complete that associate degree in nursing, go to work at the medical center, and then come back and do that BSN program right after that. So.
And what are some recruiting strategies? Do you go to I don't know, conventions, conferences, colleges around the country to recruit students?
Well, we focus on North Carolina, and particularly in this region. We'll go to Greensboro and to Winston-Salem and some of those areas. But really we found for marketing across the country, our website has been that tool.
What is your website, by the way?
It's cabarruscollege.edu. And we have folks we get inquiries every week from New York, from California, we get them from Alaska, Hawaii, people that are, they're moving to the Charlotte region, and they do a search and they want to go into healthcare, and they find Cabarrus College of Health Sciences that way. We have over 20,000 visits a month to our website, people checking us out, applying online, doing that sort of thing. So, but our primary recruitment is going into the high schools and the middle schools and working with community agencies in this region, which is what our focus is to serve Cabarrus in this region.
Any financial assistance available for?
There is. I'm glad you asked that. We have about 86% of our students receive financial aid that come to Cabarrus College.
Really?
We awarded almost $3 million in aid last year.
Wow. To
students coming in. So there's a lot of opportunities, whether it be the North Carolina Legislative Tuition Grant, Stafford Loans, Pell Grants, all those kind of things. And Valerie Richard, our Director of Financial Aid, does a great job of, like, if a student comes to our open house or comes by our office, she can sit down one-on-one and talk with them about what they may be eligible for just based on their financial background. And we've got an open house coming up September 23rd, and that'd be a great time to come meet with her and talk with admissions and that sort of thing.